All righty. Well, welcome everyone. Thank you for joining us for our first session in our app prep program. We're going to be chatting about preparing to apply and the applicant timeline today. My name is Karen Draper, and I'm a staff advisor here at the UC Davis Health Professions Advising Office. And my job and HPA's job is to help get you into the health professional school of your choice. Our staff advisors are very well trained in all areas of the application and can support you throughout this entire process. So I look forward to jumping in and chatting all about how can we prepare for a successful cycle. So, a little more insight into our application prep program. We've created this to better support you, the applicants, throughout this process. And we've very carefully crafted what workshops are included in this series, as well as what order are they going to be in. So we do put them in order of importance for applicants to focus on. This is going to be a program that spans our winter and our spring quarters. All of the winter quarter Zoom registration links are available on the event page, so you can register for all the winter quarter sessions now. In addition to app prep program and those workshops, we'll also do supplemental events to support applicants, like applicant retreats for pre-med, vet, dentistry, and nursing, as we know a bulk of our applicants are coming from those bigger professions, and we just have some extra things to chat about for those applications. Later in the summer, we'll also have our interview week, and we'll also do a couple of mock interviews later in the year. We do really encourage meeting with HPA advisors through scheduled appointments and our Zoom drop-ins for one-on-one support. So these events are going to be a great way to learn more about some big picture ideas, just getting a foundation, figuring out how things work, and then at appointments, we'll go over those one-on-one things with you. Technically not a part of our app prep program, but still going to be very helpful is our applicant updates in our email newsletter. We also have our virtual spring break med school road trip coming up, info sessions with med schools, dental schools, etc., and our summer boot camp. So we have a lot coming up throughout the year, and staying connected on our HPA newsletter is going to be super helpful. So I'm definitely not a one-person team. We have plenty of staff advisors to support you. And again, we're all going to be here to help you throughout this journey. I do want to really highlight that we're one of 2 UCs who have a dedicated pre-health professions advising office, and the only one with integrated test prep. And the reason why I want to highlight that is because UC Davis is investing in you, in your future, and you have these integrated resources already here for you. And we're here to support all current students and alumni. It doesn't matter when you've graduated, HPA will be here to continue to support you in this journey. So I like to really highlight you have a great resource here for you. A question for you all to answer out loud or in the chat. Do you know how HPA supports applicants, or how we can support you as an applicant? Test prep, personal advising, yes. Any other thoughts? One-on-one meetings with advisors, absolutely. What do you think we can chat about in those one-on-one sessions? You like the announcements we've given about clinical application cycles in our newsletter? That's great. So to take a deeper dive into what we can chat about in one-on-one sessions, it's really any questions that you have related to the application process. Whether you do actually still have some questions about prereqs to clarify, or we are filling out the application, or we're doing the written components like revising your personal statement, or doing interview prep. HPA is literally here for every component of the application. And we really do want to spend a lot of time on these things with you. That way we can support you in having a strong written application and, of course, strong interview practice as well. And there is kind of a myth that we can't get to these things in a drop-in appointment. I assure you, I see plenty of personal statements and other application components in drop-ins, and we really encourage using that as a resource. Sometimes applicants will say, well, drop-ins just isn't enough time or isn't as much time as a scheduled 30-minute appointment. And yes, that's true. However, let's say drop-ins works for your schedule where you could go all 3 days of the week. That's already 45 minutes together. So we can also think about how can we continue the conversation over time through our drop-ins and appointments. So when we talk about that, HPA services, we do have 3 different ways to get advising. Express advising is, maybe you do have some quick questions about prereqs or things of that nature. You're welcome to give us a call during our open hours. We do have our Zoom drop-ins and scheduled appointments. The only difference is that the Zoom drop-ins are 15 minutes and scheduled appointments are 30 minutes, but all questions and topics are welcome at both. And drop-ins has had an update. So if you haven't had the chance to go recently, you do schedule those in advance now. So there's no need to be waiting a super long time in a Zoom waiting room. You can schedule that 8 a.m. the day of the drop-in days. So you can learn more about that on our advising page. And we do have our programming. So we do have App Prep program, which is today. We do have other events throughout the year, which will be really helpful for applicants. And of course, as we've mentioned, we have our HPA email newsletter, and we're now on Instagram. As a quick application tip, again, consistency is key. So we can't stress enough, Zoom drop-ins is a really great option. We also really encourage, let's start application prep now in January, when logistically we have more advising availability right now. Generally, things are a little less stressful the more time you do have for revisions. And again, we can double dip and have both drop-ins and scheduled appointments. So we really encourage, let's start application prep right now together. If you are planning to apply next cycle, so 2026, you're still more than welcome to join the session today, especially if you're graduating right now. But we do just note that this process can be a little overwhelming if you are here right now. And it's okay if you decide, hey, I'm going to come to this later. We're here waiting for you whenever you're ready to apply. We also do like to know each cycle tends to be a little different. So we always encourage going to App Prep the year that you do apply. That way you can have the most up-to-date information. So that's just something to be mindful of, but everyone is welcome to attend any of our sessions. Okay, so jumping into the meat of today, our applicant timeline. So this is just going to be a quick overview for us today. We are going to be doing an activity together, but just trying to get the lay of the land. Today, we're in January 2025, and we're going to get going right now on doing a readiness check, going to HPA events and appointments, attending info sessions to help you explore schools, and doing other application prep now up until the application opens. If you do have to take or retake a standardized exam, we would encourage doing that by May, if possible. And again, we do have a test prep specialist on staff who can help you with not only talking about the logistics of scheduling the exam, but also how do you create an effective study schedule? How do you use your practice exam results to make something that makes sense for you? But also he can help with, I keep getting this question wrong. How can I do better? Or what is going on? What do you need more support in? He also does do workshops and events and a free mock exam every quarter. And then in June, that's when most applications will be open. We do encourage submitting within 4 to 6 weeks of the application opening for those rolling admissions based programs. And then ideally, we'd start to hear back acceptances in October. I will say that is quite early, and it does depend on what health profession you're applying to, of when they're allowed to tell you. And then fingers crossed by July 2026 or so, you would be starting your health profession. I do say that, again, this is a guideline. It does vary by health profession and just based on your own life, things might be a little different. So also being flexible and patient. But I think here might be easier for us to actually to just do the example together. Ooh, there's a question here. I've been hearing that people are saying applications are opening in a few weeks. Is this only for vet school? Good question. And this is part of the complexity of applying to health professional schools and having a general session like this, because every health professional school is on a different timeline. They're doing their own thing. And yes, vet schools are opening within a few weeks, but medical schools, dental schools, PA schools, they're going to be opening in the springtime. Mhm. Any other thoughts or questions before we jump into this timeline? Okie dokie. So for timelines, we typically will work backwards. So if we want to start health professional school, and actually, can we see it okay? Should I zoom in a little bit more? I'll do that. Okay. So if we want to start health professional school, typically they'll have you start in the summertime. And that can feel a little weird because you're used to starting in the fall, but you have a lot to learn. Sometimes they even have tracks for you to be a part of. So most of the time they'll have you start in the summer, but each school individually determines what would that start date be. For a lot of programs, that would have you, um, roughly in the time frame of applying in June or early July, or within 4 to 6 weeks of the application opening for rolling admission schools. What does rolling admissions mean? What do you think? And I had a little boo-boo. We're going to start there. We'd be applying right here. So rolling admissions, they accept over a range of time, not just at one moment. I agree. They admit as they receive apps. Yes, they take applications as they come. Absolutely. So to contrast, deadline admission schools means that they are waiting for the deadline to review applications. But medical schools, dental schools, most PA schools, some nursing schools, they logistically just received too many applications, so they are on rolling admissions. Rolling admissions meaning they're not waiting for the deadline to review applications. They are reviewing them as they receive them. So strategically, it actually makes more sense to apply early in June or early July, or within 4 to 6 weeks of the application's opening. But we also encourage applying ready. So there is a pretty big myth, you might have heard it yourself, that you have to submit like the first day or the first couple of days to be early. That is a really big myth out there, and it's simply not true. Applying in June or early July is still a really good time frame because we still want that application to be ready. We want you to be able to go through multiple rounds of editing with HPA, to have a strategic school list and do all the things that you need to do to have a successful application. So that tends to be the first big thing to consider, is how this process might be a little different than expected. So June or early July is that target that we have for most schools. For our pre-vets, knowing that the deadline is typically September 15th, but that's technically the deadline to have all of the application materials in by. So we usually encourage, let's aim to have it in by July 31st, if possible. And if you need, some extra time wrapping up your personal statement or experiences or whatever, you do still have wiggle room and aiming to submit it by mid-August. You're still going to be a-okay. But just being mindful of each health profession's cycle and how there will be, some differences for you to consider. Okay, so we're submitting in June, early July. The first thing that we would encourage for this process is to do a readiness check. We do recommend doing that with yourself, but then also talking with HPA because logistically, from now until June or early July, we have roughly 6 months to be working on anything that we might need to. Like, maybe it could be good to get some more clinical experience, or, maybe it does make sense to add in an extra class or two to help with your GPA. Now is the time for us to really maximize things versus if we have that conversation for the first time in May, it's going to be a lot more challenging for us to squeeze something in. So the earlier we talk about it, the better. Even though it might be a little scary, our job at HPA is to really help you find solutions. How can we help you get into medical school, dental school, etc.? So really our job is to help find solutions that work for you and your life. So we do encourage, let's start this process off with a readiness check. And then in January, we would recommend starting off with your personal statement. And so the personal statement is usually the first thing that we kick off with, and it's usually the last thing that we're wrapping up with as well. It does tend to take several months for folks to work on it as they take time to think about it and reflect, get those revisions and appointments with HPA, etc. The average applicant does go through about 7 to 10 drafts of their personal statement working with HPA alone. And that is on top of any drafts or versions that you might have had for UWP 104F or another UWP class. That's usually like the first draft that we're working with, but typically we tend to need a lot more drafts on top of that as we consider what are medical, dental, etc. schools looking for? What are we trying to show them? I'm going to pause there. Any thoughts, questions, or feelings so far? How long are personal statements usually? Great question. And that is predetermined by the application service or the program that you're applying to. So if you Google AMCAS personal statement, ADSAS personal statement, etc., the character count will come up for you. For example, for dental school, it's going to be 4,500 characters, including spaces. And typically that'll look about a page and some change or so on the next page. And it's important to note also when you include your personal statement, we don't have any special formatting, so it's going to look single spaced, no indents, and those kinds of things. Any other thoughts or questions? You're welcome. And of course, we are going to take a deep dive into each of these subjects of the application throughout our app prep program. So for example, next Tuesday, it's going to be all about personal statements, do's and don'ts, what to do, etc. Okie dokie. So moving on. So January is when we recommend starting your personal statement. And again, we'll continue to work on it over time, and we'll continue to add things over time as well. So in February is when we would encourage to start working on the experiences section. And the experiences section, sometimes folks think, oh, that's just my resume. I'm good to go. Well, that's not completely true. Yes, it will include experiences from your resume, but we're going to take it further. We're going to include all the experiences that you've been doing outside of the classroom since you graduated high school. It's also going to ask for information like who is your supervisor? What's the address? What's their contact information? How many hours a week have you done this? How many weeks have you done this? And you get some characters to talk about it as well. So you're going to want to keep track of that logistical information, and we would be working heavily on revising the characters that you get to share about each experience. For allopathic medical schools, you do get a max of 15 experiences, and you get 700 characters to talk about regular experiences, and then you get to choose 3 most meaningful. And so you get 700 characters for that, and then you get an additional 1,325 characters. It's a very specific number. And so we would work together on, well, how do we revise those 700 characters and how do we revise the 1325? Discussions also often look like, well, maybe these two most meaningfuls actually appear pretty similar. Does it make sense to even discuss a different option? Or it looks like there's a lot of overlap from what you talked about in your personal statement from the most meaningful. How can we maximize both of those spaces to share more and new things about you or different perspectives? And so we'll also talk about your application as a whole as well. And of course, again, we'll have a special section or another workshop on just the experiences section. And then in March, we would encourage, if you haven't already, asking for letters of recommendation. In our experience, asking by March can help, give letter writers enough time to write the letters, but also considering there are a lot of folks applying not only to medical school, but dental school and other programs. And so it also gives them enough time to, fingers crossed, say yes to you. What I wouldn't want to happen is waiting too late and then them not being able to do it because they've already reached the capacity for the number of letters that they're able to write for a cycle. You can ask starting now as well, just to help figure out, well, who might be available. But we encourage asking by March again to give yourself and letter writers enough time to do that. Something to note is while we're asking for letters around March, logistically, we don't technically need those letters uploaded until you start submitting your secondary applications, which is typically going to be, in that July or so timeframe, whenever you're submitting those secondaries. So that'll be something to keep in mind. Sometimes applicants will say, well, I need the letter right now. And it's like, well, we can hold our horses just a little bit, right? And we want to, again, respect the letter writer's time as well. Okay, so that'll be in March. And then during our spring break, we also have our spring break virtual road trip. So we would really encourage our pre-meds to go to that and be able to explore as many medical schools as possible. We still have info sessions throughout the quarters as well, but this is a great time to really be serious about that as well, and at least set aside some time to consider that. So I'll put spring break road trip and attending info sessions to help explore schools. And then starting in April is usually when we're having more serious discussions on the school list. And so that's when we'll talk more about strategically what schools make sense and thinking beyond metrics, where metrics can be a part of the conversation, but how do we find schools that are a good fit for who you are as an applicant? How does it relate to your past personal and professional experiences, but also your future goals? How can these schools help you be the type of provider that you want to be in the future? But also, how can you help them with the things that they're already doing? right? Because let's be honest, if you're looking at schools and you're thinking, wow, I like this, this, and this about them, chances are a lot of people like those things about them, right? So when you're thinking about these schools and you're writing your notes about them over time, it's also thinking about how can you help them? How can you contribute to that environment? Alrighty. And then May is usually when the application opens for a lot of these. And so this is when we're able to open the application, create a portal. So you're going to want to start filling it out, input your letter writer information, and you're also going to want to request for official transcripts. And you're going to need to do that for every institution that you've attended that had college or university level coursework. And you're going to need to do that from the direct source. Luckily, from Davis, things are pretty easy. If you just search up official transcript UC Davis, it'll give you a list of instructions to do. And from when you start that process to when it gets in your email inbox, it only takes about 15 minutes. So Davis is pretty fast, pretty efficient about it. And you're going to want to send an official transcript to yourself and the application service. So for that reason, winter quarter is typically the last quarter for grades. Of course, if an applicant really does want that spring quarter, that could be something to bring up during an appointment. Does it make sense to request that transcript a little later or not? But most folks, winter quarter is the last quarter of grades for them. I'm going to pause there again. Any other thoughts or questions so far? What if you're on the semester system? Then spring semester, you're pretty good to go. Most spring semesters have you end in May, so that would be included in your application. How do you determine the amount of schools you apply to? That's a really good question. Typically, the first thing applicants consider would be the finances. How many do they feel comfortable applying to? And then from there, we do have some averages depending on the health professional school. For example, the average number of med students folks apply to from Davis is 20 to 30 schools. Happy to share more about other schools if folks put it in the chat. When do we need to take the Casper? Great question. We haven't gotten there just yet, but we will soon. When we say winter quarter is the last quarter of grades, do you mean that we should plan to finish our necessary courses by winter quarter, or that professional schools will only really consider until winter quarter grades? Really good question. So what I mean is when we think about the official transcripts and sending that in, typically, if we're submitting your official transcript at the end of May or early June, then your winter quarter grades have been posted, right? Versus spring quarter is pending. So if you request your official transcript, let's say, I'm just making it up, June 1st, there's no grades for them to see just yet. So that's logistically what they have in that information. And so in terms of what do professional schools need or require, I'm going to say that'll be a one-on-one discussion depending on the health profession that you're choosing and your own specific situation. I would say most of the time folks are fine with that winter quarter, but let's say someone was applying to PA school or nursing school where they do need those requirements by the time they hit submit. I'm going to say we really want to talk nitty-gritties about things like that in a one-on-one advising appointment. Okay, continuing on, again, June, early July is usually when we're going to be hitting submit. Something to consider is if you are graduating around this time, also giving yourself enough time to celebrate, right? Take a breather or even move, right? So also considering what else is happening in your life at that period of time. But typically we're submitting in June and early July. And as you can see, all of this is included in your primary application. So that means all of this information is being sent to all of the schools that you're applying to. And so once you hit submit on your primary application, you're going to go through what's called the verification process. And in the verification process, what's happening is the application system, like AMCAS or ADSAS, etc., they are verifying the transcript entry, so all of the classes that you've input against the official transcripts that you've sent. And so they're double checking, did you copy and paste things correctly? Is the title of the courses good? Did you put the right letter grade in units? But also, did you categorize them correctly as science or non-science categories? And so that's the only thing that they're verifying. That can take upwards of 4 to 6 weeks. So it's kind of just being aware of how long that process can be. After you've been verified, that is when health professional schools receive your application. And so this is where things start to differ between medical schools and other health professions. So I'll start us off with medical schools. So for the verification process for allopathic med schools, once you're verified, that's typically when you're going to receive secondary applications after that verification window. Versus other health professional schools like dental schools, osteopathic schools, nursing, PA, vet, etc., they can actually include the supplemental questions in the primary application, meaning they can require you to do that first before you can hit submit on their school. But going back to the verification, you only have to be verified once for this process. So what we encourage is let's submit on one school to start the verification process. And then we can continue to add schools over time. Now, I know we've already talked about a lot of things today, and now we're getting into submission strategies. So this is kind of just a quick sneak peek, an overview of the process. We're going to have a session on submission strategies. And so we'll kind of take a much deeper dive there, but that's just to understand how this process works. So we've talked about verification. While you're being verified in June, early July, that is actually a very ideal time to take the Casper or other situational judgment tests as you're kind of waiting for other things to happen. We will also strongly encourage pre-writing the secondaries for allopathic med schools while you're in that verification window. And then for the other health professions, we're going to be writing those secondaries over time. So that would put us in June, early July still. And then secondaries, roughly July and August. I have a typo. Okay. And then right after secondaries, we're actually going to encourage, let's jump into interview prep. And it might feel pretty early, but the reality is, this is rolling admissions. You can hear as early as July and August when you've been verified and you've submitted the secondary, or we can find out much later in the year, or even in this new year in January time. And schools can give you as much notice as a few months or as little notice as a few days. And we want to be ready for those last minute interviews. So that's why in August, we'll typically host our interview week series and start to do our mock interviews. And so this is when we want to start interview prep. And then interview prep secondaries continue as needed. And then we go into the fall. September, of course, we're still working on, interview prep as needed. And then October is when our annual pre-health conference is. And interview invites are still happening in this time frame. I want to really share that there's a really big myth of if you don't hear back for an interview by Thanksgiving, you're not getting accepted in the cycle. That's absolutely not true at all. I have applicants even now still being invited to interviews. And really a key part of that is how do we still stay proactive in this process and continue to communicate with schools? And so that would also be something that we're doing in this time frame. We don't want you to fall off the radar as applicants and go away. We want to continue to discuss what can we do for the cycle. And again, that'll be another deep dive topic that we'll have in workshops in the future. Fingers crossed, we are having interviews in this time frame. Hopefully we find out sooner rather than later that you've been accepted. And then ideally you would be starting health professional school summer 2026. Oh, good question. Does Casper and judgment test not matter until secondaries, or why wait to take them? In our experience, we're really trying to hit submit on the primary application first. So that's why we encourage prioritizing working on the personal statement, experiences, etc. And then when you're going through the verification process, that can be a great time to do those tests. Is it true that as long as we get past GPA and MCAT minimums, we'll probably get secondaries? That is true for most schools. Some schools do review all applications first before they decide to send secondary. So in that case, you may or may not get one. Another consideration is sometimes they'll look at just a portion. For example, if community service or service orientation is really important to a school, they might take a look at how many volunteer hours do you have before they send you a secondary. But most medical schools send out secondaries to all applicants. We are recording this. We are going to put it up on our website. A good question, if you need the spring quarter to reach a certain GPA, is it fine to wait for spring quarter to end for sending the official transcript? That could be a good thing to do, but I would say let's talk one-on-one with an advisor just to see what's going on and how can we help maximize your cycle. Okay, the next question is, what's the minimum science GPA and cumulative GPA we should have to apply? And I think this is a perfect lead-in to our PowerPoint. Okay, can you all see the PowerPoint again? Can you thumbs up or yes in the chat? Perfect. Before we go to that, just another quick view of the timeline. In case that view doesn't work for your brain, here's another way to kind of visualize what are some good things to think about. And I've also kind of put up some average number of schools folks tend to apply to. And for vet med, I just put straight through because it can be a little bit more common for folks to apply straight through. And for PA, folks tend to be working full time during the time of application. Okay, so we've talked about rolling versus deadline admissions, official transcripts, verification. I think we've kind of undertoned, the importance of staying connected during the application cycle. I also do want to note the more homework you can do up front, particularly about researching schools now, the less work you'll have to do for secondaries and interviews. You'd be surprised how often, we've worked through the primary application, we've done all those great things, and then secondaries, and then applicants might ask me, so what should I say about why I apply to them? And it's like, well, you're the one that chose to do that, right? So what about them stands out to you? And in my experience, the more applicants do the research up front, usually the much more successful in this process they are in terms of getting secondaries and getting interviews, etc. So we encourage as much as possible, let's try and do as much work up front. Okay, so question for you all. What are schools wondering when they look at your application? What question do they have or what are they thinking? why you want to be in the field you're applying to. I completely agree. Why do you want to be in healthcare, medicine, dentistry, etc.? What makes this applicant different from others? Yes. Any other things? Will they be successful? Will they make it through? Absolutely. Is this person a good fit for our program? Yes. I completely agree with all those things. And ultimately, they're wondering, who are you? How does that tie in with how would you be a good fit for our school or a good fit for medicine? And how are you ready for this next step? And yes, that can align with mission. Okay, so if you haven't seen it already, we highly, highly encourage searching up the AAMC core competencies. These are the list of skills and qualities that medical schools are searching for, and other health professional schools as well. So we would really recommend go ahead, Google it, read through the definition. Even if you think you know already, it could be a nice refresher. And as a quick brainstorming tip, we also usually encourage thinking about, well, what examples would you have to share for these through personal or professional experiences? And usually we're choosing the 3 or 4 or so most important to who you are, not only as a pre-health applicant, but as a person when we think about what to talk about in your personal statement. And so if you haven't already, definitely encourage doing that. And then kind of going back to who are you? Why are you ready for this next step? Will you be successful? It does go back to the holistic admissions process, where we do have metrics at the center, and then they are considering your attributes and experiences. But metrics can be a gatekeeper in this process. So going back to the question of what GPA do I at least need to reach minimums? We would encourage that the safe GPA to apply to most programs is going to be a 3.0 and above for the overall and the science GPA. And if you do have questions or concerns, that's not a problem. We talk about that all day long with applicants. So let's have that conversation. Are you ready, or what can we do in this time, or what do next steps look like for you? And again, HPA will never say the things like, oh, you can't be a doctor, you're not going to be successful. We're never going to say those things to you. We want to find solutions with you to help you succeed in this process. And we know that it's hard. We know that there's a lot of things going on. And so we want to break it down with you one step at a time. But that is really important to consider because a lot of health professional schools do use computer screens, and 3.0 is usually the cutoff, meaning if an applicant doesn't have those metrics, then the likelihood of getting screened out by a computer is higher, meaning a person doesn't read that applicant's application. So we really want to have at least those numbers before moving forward. And of course, we do want those numbers to be as high as it can go, right, to be competitive. And then after GPAs, schools are typically going to be looking at your scores, standardized exam scores if they require it, like the MCAT, DAT, etc. And they're also going to be looking towards grade trends. But because metrics can be a pretty important piece in this factor, again, if you have any questions or concerns, let's just chat about it, whether that's at an appointment or a drop-in. Definitely both are welcome for that. They are also, again, considering what experiences have you had? What perspective do you bring? And kind of just considering, the patients that they serve. Are you going to be ready to support them effectively? So just thinking about the experiences that you've had, quality and quantity wise. And if you bring in updated experiences list or a resume, HPA would also be happy to chat with you about that as well. Letters of rec, also typically, they're a requirement in this process. In general, one science faculty. There are exceptions. Dentistry, we recommend at least 2 science faculty, but at least one science faculty. One non-science faculty who have taught you can be helpful. One health professional, and then at least one non-academic source. we are going to take a much deeper dive into that during the letter of rec workshop. We also encourage just considering finances. This can be a really expensive process, especially the more schools that we add. And knowing that a lot of schools are still doing virtual interviews, but if the schools are going to have in-person interviews, are you going to be able to go there in person and even spend a little time there if possible, as you might be a student with them? And also consider time, right? What else do you have going on? What other responsibilities do you have? Do we have the time for you to do all of these things and be successful? Because what we wouldn't want to happen is for you to be so overloaded and then not do well in these things, right? We want you to have the time that you need to be as successful as you can in this process. So some tips for managing the cycle, let's take things one step at a time, and that's how we've laid out App Prep program. Let's set aside time weekly as well. You might be surprised with how much this content adds up. So if possible, let's treat this as a class where you're spending at least 3 to 4 hours a week on this. Be aware of outside information. I have kind of laid out a couple of common myths that you might hear or might have heard already. And so be really cautious of where do you get information, even if it appears well intended or it's coming from a friend or someone in class. Just being aware that that information may or may not be true. It's definitely always worth double checking and asking, but also coming to these events like App Prep where you know you're going to get good information all the time. We also know that this is a scary process. There's a lot going on. But again, we're here to help you throughout this process and to be kind to yourself, right? And when you have an idea, go ahead and just jot it down throughout the day or, use, some downtime throughout the day to do some brainstorming or tracking down that contact information to help chip away at all that uh, information that you're going to have to input in the application at some point. Here is a kind of a quick guide of all the different things that you'll need to do at some point or another for the application. And again, if you want to be a health professional, it's really a matter of when are you going to get to health professional school, not if. Everyone's journey will be different, and HPA is going to be here to support you whenever you're ready. And so it's really taking the time that you need to succeed and do all the things that you need to do. HPA will be here to support you whenever that is, or whatever decisions that you do make. So thank you all for joining us today. Here's how to stay connected and subscribe to our email newsletter. One, two. Let's see. I'm going to go ahead and head over to the chat.